good heat because you get a little good heat actually. The agarbatti, we don't get so much heat actually. That is what I found. So instead of agarbatti, I prefer cigarette only, and that we require only half length of the cigarette. That is enough actually. Now you see, this is the length I have given here, little more, but quarter is slice also. That is enough for the treatment. When you treat for one person, you treat 3 points here, 3 points here. That is enough 3/4 inch. And that with the best heat also, it gives a benefit also. That is what I have found it. So this moxa, you see, what you call the smoke of this moxa, what we can say, you get a first cure of asthma. That is the first benefit. In the case of asthma, bronchitis also. Then you can say in the case of low BP, then neck pain, then stiffness of the fingers also. Then it is best for the tennis elbow. I say tennis elbow. It works wonderful. Because for tennis elbow, yes, most of the time, they have to go for cortisone or that sort of medicine only, steroid medicine. I'll say with this, they will get the best result also. And I give advice to them, go for this, do it yourself, and see me after 1 week. You can see the best benefit of this. If you take along with this medicine, any medicine, that works wonderful also. I say it works wonderful. So that is for this actually now in the case of depression, person who is having depression, now taking regular medicine for relaxation of the mind and other things. I'll say if you do it over this, particular spot is here only, but if you apply over this meridian, give little heat over this, just for 15 to 20 seconds or more, this I total. They within 2 days, 3 days time, you can see the improvement of their thinking as well as talking also. I say the way the earlier, what he was telling to us, and now within 3 days you can see the improvement also. That is my first choice actually. So that is for the depression. Now in the case of, say, I'll see those who are knowing little more about problem with the cardiac. So when you treat a particular this spot and give little heat over this, correct? It may not be more than 5 seconds or 10 seconds, both the side. If there is a pain related with the heart, some benefit, you can say some benefit, they will feel something better and they will say, well, do it again and I'm getting some benefit also. In the case of high BP, low BP also, I prefer this only. Because you don't require to give little pressure also. Because here people, they are much more on this side. If there is any something related with the pain, they will say, I am not comfortable. But here see, we are not using any gadgets also, and we see the benefit also. Then I consider the case of person is having a vertigo. Vertigo in the sense, it may be due to ear problem, maybe due to high BP, low BP, we can't say anything. Giddiness may be due to any reason. So when you treat over this, one is here and second is here, this meridian. You have to give little time for this meridian only. And just here only, about the leaves actually. That also for 5 seconds only, I'll say 5 seconds. Immediately the person will tell you, my giddiness, fatigue is gone, or he will say, I'm feeling better. That is what I have said with this. It's a very simple and best approach also, I will say. You see, if you want to give any medicine, give medicine afterwards. At that moment, person is feeling better. What else you want? Now I tell you, one of my experience in the sense high fever. See, for temperature 3 and 4, you require medicine, you have to wait for half an hour. I will not give it all even for once actually my daughter was having a little 4 temperature and she was shivering also. I had given homeopathic medicine and all that. It takes time, at least 15-20 minutes required. So I did a moxa with this point, and just over here, the neck point. You see, particularly this neck point. You won't believe within 15, I say 15 not more, within 10 minutes, the temperature was normal and there was no fever. In the night also, the next day also there was no fever. Now how it is responded, I don't know, but this is my personal experience. So we must try this sort of approach and we must take a benefit. Now agarbatti is very easily available, correct? Apply it little and you get the benefit of it. Then now related with the knee joints. Then I'll say backache, hip joint, whatever we are doing for the vacuum cup therapy, we can get a benefit here. But somewhere, if there is a related with a little more weight is there, I prefer vacuum therapy. That will give a better result also. And when you are dealing this particular area, I mean, now say this area, there is no weight. So if you apply a little heat, you get a faster benefit. Then in the case of pain-wise, I am talking about pain-wise. Then you can say, what you calculate spot. Now that is very painful. People cannot walk. In the case of diabetic patient, food practically very sticky. They don't have sensation. Also, they are walking. Also, they are getting any sort of a sensation there. Even if you prick with some item, they will not feel any sort of gadget you have applied actually. So this is what I have observed. So this sort of science, it works wonderfully. Then you come to what you call in the case of during dysmenorrhea, in the case of female patient, any pain is, lower abdomen pain is there. In that case, it works wonderfully. Now, in the case of swelling it may be due to problem with the KUB tract or due to any other reason also. It works wonderful and you can see the result same day only. 50 to 70% of relief is in this only. Then I'll say any problem in the sense sort of a specifically diaphragm to lower abdomen, any complaint in there is above the diaphragm, 4 fingers up and 4 fingers below. If you apply this heat, no pressure, nothing, they will say, I'm feeling better with this. Any complaint, related with any complaint is there, they will get a relief. That is what I have observed. But that is a rare case we get. Thing is, if we can try with this and we get a benefit of this, then I consider like what you call, in the case of what you call hemoglobin, because whatever, in the case of what you call iron deficiency is there, definitely digestive system is not proper. But if you treat spleen, now those who are knowing little more about the spleen therapy, spleen meridian, if you treat it properly, they will improve their appetite as well as their immune system. And they get the best benefit with this science only. Now here we are not giving any medicine or any vitamins. And once you improve that energy level of that spleen, and that gives the best result. That is what I can say with this. Now this is related with the disease-wise I told you. When you treat with the moxa, there are two factors you have to keep it in mind. When you are treating a patient, our mind should be, or at the time of treatment, our concentration is the patient only, or what we are doing, or what we are treating. Otherwise, what happens, if you are treating here and talking to somebody, it may touch to the skin. Person will get a little sort of a disturbance, correct? It may be either there may be burn also, or we are giving disturbance to the patient. So that we have to keep it in mind. Second part, you have to see the cloth of the person while at the time of treatment. Now somebody may come out from this with a toothpick I am using, correct? Now if it will loose, it may come out any time also. So we have to take care of the cloth also. Or sometimes if you are treating person having a silk dress or something due to very, we cannot nylon or that sort of cloth is there. You have to take care of this. That two parts I have to consider very, very specifically when you are treating a patient. Third part, I told you, diabetic patient. When the sugar level is little low, you have to see to that if the person is having a regular complaint of this, you have to take care and give little food and then you. And once you give to some food, I don't find any complaint in the day. Now, one thing is remaining. This particular spot, this, from my part, if you consider, when you relax this, first is this, second is this, and the third is this. You treat with this moxa 70 to 80% without asking any complaint related from head to toe. You can cover with these 3 points. 1, 2, and 3. That's my choice, and I give advice to everybody. And I call it as a Brahma, Vishnu, and Manas. Okay? These 3 points works wonderful. And with the name of God, when you are treating, that is a plus point also. You get a faster benefit also. When you are dealing with the cosmic energy, you get a benefit also. So not necessarily other person should have faith in the science or prayer or something. We don't want that. You do it very sincerely. You see the benefit. And what I am doing at present, you see, I am very lazy chef. I prefer to prescribe the medicine. My work will be over within 3 minutes. I don't have to give more time also. If you prescribe the medicine, you don't require much more time. But sometimes what happens, the medicine takes enough time to give relief. See, everybody may be telling you also that homeopathy works very slow. I don't agree with this. If there is acute pain, you must see the 90% relief same day on acute case. Correct? Now, sometimes it is very painful. I have come across with so many. If I give that information, no, I may require or I may 100-page book for that only. So, what I want to pain-wise, we must see the relief same day only. That is what I am saying. So, this is what I can say. Moksha and this, moksha and the vacuum therapy is a part of acupuncture. And I say, when you don't want medicine for painkiller, I think we can give the relief as well as cure also. If you give little more time, definitely we get a benefit of this. That is what I can say to you. Now there, our Indian massage is there, massager is there. They gives a relief. I don't say no, but then you require enough time and other. Here we can manage ourselves only. What is our intention? We should manage all these things ourselves only, without anybody's help also. That is what we want. If there is any